Hello, I would like to welcome you all today to this global webinar, Autism, Meditation, and Stress. We are coming to you live from America's capital, Washington, D.C. I am television news anchor Rita Cosby, and I will be the lucky person to be your host for this incredible and in many ways groundbreaking webinar on this important topic affecting so many people and their families. Today, we are examining Autism Spectrum Disorders, or ASDs, which the Centers for Disease Control and Prevention describe as a group of developmental disabilities that can cause significant social, communication, and behavioral challenges. Today, autism spectrum disorders are growing at epidemic rates, affecting 1 in 88 people. Many people with ASDs suffer anxiety, sleep disturbances, poor self-regulation, and sensory sensitivities, all of which significantly impair daily functioning and quality of life. People with ASDs frequently struggle with transition and changes in routine and find social interactions stressful, to say the least. Friendships tend to be difficult. Individuals with ASD commonly struggle to perceive social cues, interpret the social intentions of others, recognize the impact of their own actions in social situations, and respond in socially conventional ways. Reducing stress and anxiety has the potential to significantly improve the quality of life of people with ASDs and their families. However, very current treatment for anxiety and stress is very limited. Today, we are looking at the effects of a simple, evidence-based meditation technique practiced by more than 5 million people, popularly known as Transcendental Meditation, or TM. It has been found capable of improving these symptoms in the treatment of ASDs. So why is this relevant today? Because conventional treatment options for ASDs are limited. And because, to be direct, TM has an excellent track record of success for reducing anxiety and stress and improving the quality of life for children and adults with autism. I am the godmother of 2 beautiful autistic young boys, so I know how important this is firsthand. I've also been practicing TM for more than 3 years. We begin our meeting today with this very short video which highlights one young man's journey with autism spectrum disorder towards health through transcendental meditation.
I thought my kids were going to be the smartest kids, the best kids. I wanted to do everything I could for my kids to make sure that they were above the norm. Alex started speaking very late. He had extreme sensory issues. He would scream every time I would brush his teeth. He would go up to the other kids and bump them with his head. He just had trouble functioning. But at the same time, he had so many good qualities, and I could see those. It's just that most other people couldn't. The kindergarten teachers said to me, I don't know what we can do for him. I don't know if he's, if I can even help him. We did an evaluation with him. He qualified for the autism program, and then he had a medical diagnosis of Asperger's syndrome. It was really discouraging. In middle school, he was relentless. The crying, the screaming, the anger, the temper tantrums, but we struggled with it. We really did. I was withdrawing a lot, and I didn't know how to deal with him. I just thought, what am I going to do with this kid? What kind of life can he have? We have used so many different therapies, the brushing therapy, occupational therapy, social skills therapies, and those are all good. However, transcendental meditation is one thing that has an effect in many different areas. He started TM, and then about a month went by, and one morning we woke up, and I said to my husband, he hasn't had a temper tantrum in, when was the last one? A week, 2 weeks ago? It was incredible. And we weren't doing one other thing differently. He loves it. He's done it regularly. He does it twice a day, and it's easy for him. It was such a relief to be out of that mode where you were waking up in the morning just bracing yourself. When is he going to start screaming? He's turned into a happy, well-adjusted kid. He loves excelling in school now. Was never interested before.
I started meditating at about mid-7th grade, and I got mostly A's in my second semester of 7th grade. I would say TM is certainly, that very directly helped me get good grades.
From 9th grade up until now where he's at, he has grown tremendously. He's really gelled into the mainstream classes and is starting to become more social with his peers.
He's taking both AP classes and college credit classes, and he's excelling. He's been on the honor roll every single semester since he started meditating. He's joined the robotics team. He has become an Eagle Scout, which was one of his dreams. I didn't think that he probably could have a normal, independent life. I didn't foresee him going to college. And now I see all of that.
When I go to college, I'll certainly continue meditating. TM has helped me to communicate with others and get along with others and be able to focus well on tasks.
Just seeing how Transcendental Meditation has had such a tremendous effect on my son and our family makes me want to really encourage anyone with kids with autism to give this a try. This is really a tremendous tool to help these kids.
And Alex, again, is getting straight A's. Quite remarkable. Well, we're very fortunate today to have with us two of the leading scientific experts on the impact of transcendental meditation and stress, anxiety and health, and also its impact on autism. To my left is the very esteemed Dr. Norman Rosenthal. Dr. Rosenthal is the world-renowned psychiatrist who first described seasonal affective disorder, SAD, and pioneered the use of light therapy, which has helped millions of people around the world. He's an expert on the medical benefits of transcendental meditation, the author of over 200 scholarly articles, and the best-selling author of 8 popular books, including Transcendence and, most recently, The Gift of Adversity. He is a clinical professor of psychiatry at Georgetown University School of Medicine. Great to have you with us here, Dr. Rosenthal.
Great to be here. Well, what I want to tell you is that TM is a form of meditation that is easy to learn and practice, but very profound in its effects on both the body and the mind. As far as the body is concerned, it settles down the sympathetic nervous system, which mediates our fight or flight responses. And this has actually got clinical implications because it doesn't only occur while people are meditating, but goes through the whole day. For example, there are a lot of studies showing, controlled studies, that TM can reduce blood pressure. And we know high blood pressure is the so-called silent killer. And this is so impressive that the American Heart Association has actually endorsed TM as a legitimate treatment for hypertension. But the effects of TM extend to the mind as well. It reduces anxiety, again, probably by lessening the impact on the fight or flight response system. It also lessens the reactiveness to unpleasant stimuli. And this, again, has had anecdotal benefit to various clinical conditions like panic disorder or anxiety disorders. And these anecdotes are now moving into clinical practice and research studies. One good example is post-traumatic stress disorder, where people are badly traumatized either in battle or elsewhere and go on to be hypervigilant and hyper-aroused, have flashbacks, insomnia, and are just easily startled because there again, the HPA, the hypothalamic pituitary adrenal axis, which is allied to the sympathetic nervous system, is geared up and overactive, and TM again settles it down. For example, my colleagues and I did a pilot study in veterans with combat-related post-traumatic stress disorder, and the symptoms were reduced by 50% following just 8 weeks of treatment with TM. There was recently a controlled study in African refugees with PTSD. Again, very encouraging results, and a large controlled study is currently underway in veterans, US veterans with PTSD. So all of these things are very encouraging about the reduction of anxiety. So that brings us to autism spectrum disorder, which is a complex condition about which you'll hear more from the next speaker. But at this point, what I'd like to emphasize is that an important component of autism spectrum disorder is anxiety. Anxiety that can be very distressing and even disabling, interfering with people with autism spectrum disorder who then tend to want to avoid novel situations, social situations, and interpersonal closeness. As I surveyed the various conditions for which TM might be useful, I came across several young people, adolescents and young adults, with autism spectrum disorder who reported considerable benefit. And that made me very curious about its potential in this particular condition. It turns out that these young people learn very readily how to practice TM and actually enjoy it. But imagine my delight to find that many of them also report very impressive changes. And it's not just they who report it, but their families as well. For example, they will be more inclined to explore novel situations. I remember one young man who suddenly was willing to eat new kinds of foods that he avoided before, or another who was hugging various members of his family, whereas previously he kept very much to himself. And then there was the student who had been labeled a, quotes, problem child, but now was getting the Student of the Month award, which was very unexpected and very appreciated. So we are now at an anecdotal stage. We don't have the clinical trials yet, but to a parent with an autistic spectrum child who's looking around for something to help, it's very hard to ask such people to wait the lengthy time involved in getting clinical trials accomplished and publications published. These are lengthy processes. I would recommend that such people should consider right now the possibility that TM might be an option to help with all the difficulties, especially the anxiety associated with autism spectrum disorder. But clinical trials are certainly needed, and we are hoping to initiate those trials, as you will hear from the following speaker. Thank you.
Dr. Rosenthal, thank you very much. Fascinating. And to Dr. Rosenthal's left is Dr. David Black, who's also with us. Dr. Black is a pediatric neuropsychologist and scientist who is a nationally recognized expert in autism spectrum and related disorders. He has spent much of the last 10 years working clinically with children, adolescents, and adults with autism spectrum disorders. He is a researcher in the Pediatrics and Developmental Neuroscience branch at the National Institute of Mental Health, NIH, where he has been investigating the factors that contribute to the best outcomes among children and adolescents with autism spectrum disorders. Dr. Black, great to have you with us too as well.
Thank you so much for having me. This is such an exciting webinar we're doing today, and in particular I'm excited about the prospect that Transcendental Meditation holds for individuals on the autism spectrum. As you described earlier, autism spectrum disorders describe a complex syndrome in which there are difficulty with socialization, with communication, and where there are very often the presence of unusual, restricted, or repetitive behaviors. The Centers for Disease Control estimates that the rates of autism are 1 in 88 in general, but affecting 1 in 54 boys. And the worldwide estimate of autism puts a prevalence rate at around 1%. And in fact, there's one study out of South Korea that suggests the rate may be even higher, as high as 2.4%, or affecting 1 in 38 people. Because autism fundamentally impacts one's ability to socialize or to interact with others, most of the day-to-day routines are fundamentally stressful. Most routines involve social interaction in one form or another. There's also a strong need for many on the autism spectrum to have consistency, to have routine, and that itself poses its own source of stress and challenge when things unexpected happen on a day-to-day basis. As a result, many people with autism spectrum disorders are in a state of chronic stress. This chronic stress has numerous downstream consequences, including higher rates of anxiety. Most studies put the overall estimate at around 40%, but some suggest that prominent anxiety symptoms are as high as 80%. There's also trouble with sleep. There's trouble with emotion regulation, self-regulation. And as individuals go from adolescence to young adulthood, depression rates climb quite a bit as well. The cost of this to the individual, to family, and to society is enormous. Many children and adolescents have great difficulty moving into independence, taking on adult responsibilities. Families incur much higher psychological and financial burdens, and there's enormous cost to society. At this point, as Dr. Rosenthal has said, there is not very much research supporting psychological interventions to address the anxiety and stress, or pharmacological therapies also have proven to be challenging, to say the least. So as we think about, well, what can we do about this? How can we target the anxiety and stress that is so common in autism spectrum disorders? I happened upon the opportunity to meet with Dr. Rosenthal, and I learned about many of the anecdotal reports of adolescents and young adults with autism spectrum disorders who are benefiting greatly from Transcendental Meditation. And that led us to undertake a very small study to see, well, can we find a group of children and young adults who meditate consistently, who are on the autism spectrum? And if they can meditate consistently, do they benefit from it? What we found from this study was rather startling. We found that, one, nearly all of the individuals we evaluated were able to meditate consistently, and two, they reported dramatic decreases in anxiety, reductions in stress. There was consistency in the adolescents, young adults, and their parents describing much better emotion regulation, the tantrums or the difficulty with just tolerating very small changes in what they were expecting to diminish significantly. There was also this rather startling increase in the willingness to try new things, to do things that they hadn't done before. As we thought about this, we thought, well, we should see if we can provide some scientific evidence to better understand whether Transcendental Meditation may be an effective intervention for individuals on the autism spectrum. And that led us to do a controlled trial that will be starting in the next 2 months of about 30 adolescents who all have an autism spectrum disorder. This study will allow us to examine whether an unselected group of students are able to meditate and what the effects of that meditation will be over the course of 3 months. The study will contrast them with a control condition or an alternative intervention that is not meditation but should be helpful in addressing stress and anxiety. Our goal with this research is to take the anecdotal findings that we are hearing on the internet, in Dr. Rosenthal's book, and in the research that he and I have conducted together, and to take it to a point where there may be scientific evidence to support this kind of intervention.
Fascinating work. You talked about, Dr. Black, the number of boys versus girls. I thought it was staggering. 1 in 54 boys.
Right.
Why is that? Why is autism so high in boys versus girls?
Well, we know that developmental disabilities, of which autism is one, affects boys much more greatly than girls. It's true for other conditions such as ADHD as well. It's not entirely clear why that is, but what we know is that these boys need help.
It's a significant difference, it seems, from what you were saying. Dr. Rosenthal,
Absolutely.
you're the TM expert here. Is it different for young boys, young girls, women versus men for Transcendental Meditation?
Well, the great thing about TM is it's an equal opportunity form of meditation, and everybody can benefit from it. And it doesn't matter if you've got a monkey mind that jumps all over the place and got ADD, somehow it works. And if you're one of those very focused, organized people, it works. So that's what I've been so impressed about, how many diverse people can benefit from this one simple technique.
How different is the reaction to TM versus medication? As you both highlighted, that the current medications right now, the impact, I guess, on those, particularly with ASDs, it's a very low result. It's not really having a significant impact in changing their ability for better health. How much more staggering have you seen the results with TM?
Specifically for autism spectrum?
Yes, for ASDs.
Well, I think that in general, our love affair with medications is on the wane, because we're very impressed not only with what they can do, but with what they can't do, and with side effects. And so I think that wherever one has a non-medical approach that can work, that can give relief, as we saw in the video, we want to try and prefer that before resorting to medications.
Absolutely. And Dr. Black, obviously, there are skeptics out there. What do you say to the folks from the hard evidence that you've seen so far? I know you're doing another study with Ivy Mount, but what you've seen so far, it is actual real results.
Right. Well, here's what I would say. Many of the interventions out there carry some risk of side effects, whether the side effects are from medication, well, primarily from medication. There are some side effects. With Transcendental Meditation, if it works, there are virtually no side effects, and it can have a profound effect on many aspects of a person's functioning. It can reduce anxiety and stress and improve sleep. And so from my standpoint, if you've got an individual with an autism spectrum disorder that is struggling to manage the stress of their day-to-day life, they're struggling with anxiety, the evidence I've seen so far, which at this point is anecdotal and observational, but that we've seen so far really suggests that this may be a very promising approach.
That's very interesting. Thank you both. Very much fascinating. Great. And moving on now, this webinar is co-hosted by the David Lynch Foundation, the Center for Autism Assessment and Treatment, and the Joey Lowenstein Foundation. My next guest is the founder and chair of the Joey Lowenstein Foundation, Roberta Lowenstein. Before we talk to Roberta, I invite you to watch the short video about Roberta's remarkable son, Joey.
For the first 14 years of his life, there was no writing, there was no reading, there was no speaking. He was locked inside. He is the man who never gives up. He has persevered in silence while he was learning, and he was absorbing everything, and he couldn't tell us. At 2 years old, it was almost like a door slammed shut, and my son stopped answering to his name. Whatever words he had, he lost them. He was diagnosed with autism. There was a lot of turmoil, a lot of sleepless nights. Two years ago, I found a way of Joey to communicate. His thoughts and his desires have come out. That has totally revolutionized our life, Joey's life, my life, anyone that's around him.
Like that.
I meditate with Joey every morning. Initially, he could only do about 5 minutes, and then he'd jump up. But we've gradually increased it, and now he and I can be in the room for 20 minutes, assuming he's not starving for breakfast. Joey absolutely loves Transcendental Meditation. It's something he really looks forward to.
TM is the best start on the day. TM is the best start on the day.
It's part of our routine every morning. It's something that really binds us together. Joey started writing on his letterboard that he wanted to start a business. He wanted to help other autistic people find their voice like he had. And also raise money for children that have autism to learn how to meditate. I see that Joey is making vast strides.
How can TM help others with autism? You know they need help to settle their minds too. applying to my foundation for help. Make this truly happen.
He is the man who never gives up and is such a happy soul and a good person and really wants to help the world.
And joining me now is Roberta Lowenstein. Roberta is the mother of that extraordinary young man that you just saw there with autism, 17-year-old Joey Lowenstein. She is also the founder and chair of the Joey Lowenstein Foundation, a nonprofit which focuses on athletics, nutrition, self-development, RPM, rapid prompting method, and seizure and brain research. Through fundraising, the foundation will have the resources to help people who have autism break the barriers of autism and find their own bridge to communicating who they are and what they are capable of doing with their very unique gifts. Roberta, that was such an incredibly moving video. Your son is just so inspiring. I have so many questions to ask you, but we're just going to do a few here for this wonderful webinar. First of all, tell us how TM has helped your son Joey, how it's helped your relationship with the two of you.
Well, our relationship has gotten stronger and we've bonded more together, and it's something that we can do twice a day for 20 minutes where we're just quiet and but we feel each other's presence in the room, and it's really just helped my son calm. And as to quote Joey, he said, "Mom, it helps me calm the mind and the mom."
Calm the mind and calm the mind. That's
Yes.
a great line.
Yeah.
And Joey said that.
Yes.
Joey translated
Yes,
that.
he did that on his letterboard, which is how he communicates.
Unbelievable.
Yeah.
Did you ever imagine it would create this incredible bond between the two of you?
I had no idea, because prior to that I never really had this quiet calming of minds together, and it really has helped us tremendously just bond, and we just enjoy it. It's something, when I say to Joey it's time to meditate, he runs to his room, he puts on his blindfold, and he's ready to rock.
You know what's amazing? You think about any 17-year-old boy or any 17-year-old period sitting still for that amount of time. It's remarkable to see Joey doing that with a smile on his face. How long did it take you to get to that process?
Well, in the beginning, I had learned to meditate, and I talked to Bobby Roth, who's the executive director of David Lynch, and I said, "Do you think there's any possibility that my son, who's autistic, could possibly learn to meditate?" And we tried, and eventually Bobby came to the apartment, and we actually would sit with Joey. And initially it was just 2 minutes, and then he would jump up and take off. And gradually, I just work with Joey, and over time, we now do 20 minutes twice a day. And he
Twice a day?
Yes.
And he does it?
And he loves it.
That's
Yeah,
amazing.
Yeah, he loves it, because he really does feel that it helps him, and it helps him to focus on what he needs to do during the day.
What would you like to say to so many parents listening right now about TM and also about your wonderful new foundation, the Joey Lowenstein Foundation?
Well, I'd like to tell the parents out there that this is something that they can learn, and then they can also have their children learn. They can learn it together, and that it's really easy to do, and it really does help. It's helped my son's behavior. It's helped his demeanor. It's helped him in school. It's helped him in life. It's helped him when he gets in the elevator. He's just much calmer. And the foundation was Joey's idea. He came to me about 1.5 years ago on his letterboard, spelling out that he wanted to start a business or a foundation to help other people that don't have the same opportunity that he's had, whether it's athletics or really amazing nutrition that he's on, or self-development, which is the meditation, RPM, and also we're going to support seizure and brain research, because there's a lot of new things that are coming online now about that. So we're very excited about it, and we hope that people will come forth and want to support what we're doing, and all the money that we collect will go to whichever area they want to support, or all of the areas. So I'm very excited to be here today.
How touched were you as a mom to know that your son, with this incredible ability, wants to give back and now help others?
Right. Well, he's a very special soul, and you all saw him on the video, and he's amazing.
He certainly is. Roberta, thank you so much, and give our best to your very heroic son, Joey, with the Joey Lowenstein Foundation. It's awesome to hear. Thanks so much. And we're moving on now to our third section of this webinar. I would like to show you another video of how Transcendental Meditation has profoundly impacted the life of an entire family, like you heard with Roberta and her son, Joey. In this case, a teenage son with autism learning to meditate.
As a parent of a special child, you're always giving, and you're not getting any satisfaction of seeing any results. Nothing is returned. When Jackson was little, he had a speech therapist, and I would say, just get Jackson to say yes. All he would say is no. Raising Jackson with autism was very stressful, and it took a lot of toll on the family. It affected a marriage.
Jackson's always been very routine-oriented, and any sort of break in his routine would cause a huge uproar. Especially when he was younger, there would be times where we'd have to literally drag him out of the house while he's kicking and screaming.
He would be like a pressure cooker, and he would just let off steam. He would close his eyes and he would shake and he'd start getting really upset. He wanted to make friends with everybody, but he doesn't talk very well. And he couldn't make that eye contact, so he couldn't make that bond to actually have friends. I said, you know, you get a car if you learn to drive. So he was with a driver school, and they said he has too much stress. You need to get him some anxiety reducer so that he can drive. And that's when I decided, that's it, we're going to go learn TM. Since then, his life has made a 180-degree turn. He doesn't have these tantrums.
There's not as many outbursts.
He smiles much more than he ever has, and he looks at you in the eye. There's much more eye contact.
Every time I meditate, I just feel like I'm fully blessed, I'm fully re-energized. Makes my day a lot more easier.
2 years ago, he got his driver's license. My brother came up to me one day and says, Jackson got his driver's license? I didn't think that was ever going to be possible. The other thing that was huge for Jackson is that he got his first job. Since he's been meditating, it's an unfolding process. Every month, there's something new, something expanding in his world that wasn't there before. He's more caring about other people. He seems to be able to reach out to other people.
Take that all the way to the other side. Special delivery!
I'm having a bad day. About 2 months ago, he said to me, Mom, you need to go meditate so you can think straight. So he's driving, he's working, he's in a bowling league. He goes out on Sunday nights and bowls. And now he has friends. He's a happier human being. He learned TM and all these wonderful things happened.
I know with all these improvements that he made in such a short period of time, that he's going to live a normal, happy life. Our family is able to benefit from all of us meditating.
Life is much better. Life is easier. It took Jackson a long time to be able to give back, and now he's giving back. He's the joy of my life. It's been such a remarkable change in Jackson that I can't imagine that other families and other kids wouldn't get the same experience that Jackson did.
Amazing. Jackson is driving and he's working. How terrific is that? Well, I am joined now by Dr. William R. Stixrud. Dr. Stixrud is an eminent clinical neuropsychologist and an expert in the assessment of children and adolescents with learning, social, and emotional disorders. He has authored book chapters and articles on the adolescent brain, the effects of stress on learning and emotional development, and the benefits of transcendental meditation for students with ADHD, attention deficit hyperactivity disorder. He's also a member of the adjunct faculty at the Children's National Medical Center, and he is an assistant professor of psychiatry, behavioral sciences, and pediatrics at the George Washington University School of Medicine. Dr. Stixrud is also a rock and roll musician and plays in the band Larry 2.0. I am calling him the Rockin' Doc today. And Dr. Stixrud, so great to, very diverse, lots of talents here. Thank you so much for being with us.
It's a pleasure to be here, thanks. So I've been doing clinical neuropsychology for 30 years, and it never really occurred to me to teach TM to kids on the autism spectrum until Serena Grosswald and I did a couple studies on middle school kids with ADHD, teaching them TM. In the first study, one of the kids who benefited the most was this boy who was very socially awkward, and before we started meditating, didn't make eye contact with the other kids, was very socially isolated. And we heard from his teachers that after 3 months of meditation, he was starting to fool around with the other kids, and he actually went to the principal of the school and wanted more social clubs, social opportunities. That got our attention. And we did a second study, and a kid, the year before we started the study at the school, she knew how to meditate, but she didn't want to do it. She wouldn't refuse to do it. And at one point, she bargained with her parents. She said, I'll meditate if you take me all these medications. She's on 4 or 5 psychiatric medications. And the parents agreed, and over time, they weaned her off the medications, and the girl started practicing TM twice a day. And her teachers told us that by the end of the year, this kid was so much better than she'd ever been. And I'm not saying that if kids meditate, they never need medication, but we really learned that kids with a lot of social difficulty can meditate, and they can benefit from it dramatically. And this wasn't surprising me entirely, because the experts on stress say that there's 4 aspects of life that make it stressful: novelty, unpredictability, perceived threat, and a low sense of control. And we know that the people on the spectrum, as David and Norman were saying, that except for the most familiar situations, everything tends to be novel and unpredictable. And so many of the kids in the spectrum also are so sensitive, their sensory systems are so sensitive, that the world feels more intense and more threatening. And in part because they don't get the social logic of the world that well, and in part because they have trouble flexibly adapting, they experience a low sense of control. So it turns out that kids in the spectrum are wired to be anxious and easily stressed, which is a challenge, because we know from 30 years of research on learning that it's very hard to learn if you feel unsafe and you feel stressed. And we know that it's very hard to activate what Stephen Porges calls the social engagement systems, the aspects of our communication that allow us to engage with other people when we don't feel safe and our stress response is turned on. So the great challenge is helping kids on the autism spectrum feel safe in their own skin and feel safe in the social world. And if we think about the interventions that are used with kids in the spectrum in schools, there are things like minimizing transitions and visual schedules and social stories, and giving kids a safe address or a safe room in the school that they can go to, a safe place where if they're stressed they can go and kind of recover. And what it's looking like in these anecdotes that we're hearing about these many, many kids is that TM can actually accomplish this goal from the inside. That many of these kids are really experiencing that they have a safe address inside themselves. And what happens is when kids, just like adults, when they meditate and their stress hormones start to normalize and their brain starts to work in a more coherent manner, that their thinking gets more orderly, and they get more flexible in the way they handle life, and that they adapt to life more easily. And the other really interesting thing is that we know that from the very earliest research on TM, one of the things that demonstrated so clearly is that people who meditate are less reactive to stress. They don't respond as much to stressors as they did before. And this has to be related to this finding of a study that was done 6 or 7 years ago, where they recruited experienced meditators, people who've been doing TM for 30 years. And they had them put their hands in hot water that's hot enough to be very painful. And they looked at how does the brain react to the pain. What they found is that 40-50% less brain reactivity in response to pain in the experienced meditators. So they're curious, how long does it take to get that? Do you have to do it for 30 years? They taught the control group. And the control group within 2 to 3 months also experienced 40-50% less brain reactivity to pain. Now, the really interesting thing about this in relation to autism is that it's looking like the brain circuitry that responds to physical pain is the same circuitry that responds to the pain, the social pain, the pain of rejection. So this may be one mechanism why when people learn TM and they practice it regularly, they tend to have a better mood. They tend to have better stress tolerance, and they tend to be more flexible in the way that they manage their life. And the last thing I'll say is that I want to go back to what Joy Lowenstein said about TM calming the mind and calming the mom. That we know that parents of older adolescents on the autism spectrum, that they tend to have stress levels that are comparable, stress hormone levels that are comparable to those of soldiers in combat. So ideally, we make TM available to the parents of kids in the spectrum as well. It's a very stressful job. But if just kids meditating can calm their parents as well, this is a really good thing. And I'll just say that in the last, in closing, I'll say that over the last two or three years, I've been talking with kids a lot about stuff that can be life transforming. I mean, there's a lot of interventions that help a little bit. But I talk about stuff like deciding to get a good night's sleep every night, or getting a girlfriend, or various things that can be life transforming. And you think about it, that over the course of the last 2,000 years, millions of people all over the world who meditate regularly have described it as being life transforming in the sense that it changes the course of one's life in a positive direction. And I think what we're hearing, and it's certainly my experience and experience of David and Norman and the kids in the video, is that practicing TM in kids in the spectrum, very likely that they're no different in the sense that this can be really something that can be life-altering.
Fascinating, very much. Thank you so much. And it's interesting how the impact you're talking about doesn't just affect children with autism, it's also soldiers, it's the whole variety. We're definitely going to get to a lot of questions. I have a lot on this. To Dr. Stixrud's left, we have Dr. Serena Grosswald. Dr. Grosswald is an expert in cognitive learning, focusing on improving stress-related disorders. Her first of its kind research on the effects of Transcendental Meditation program on children with ADHD and Autism Spectrum received worldwide attention. She has published and lectured extensively in the fields of medicine and education. Her work has also been featured in a lot of places, including U.S. News and World Report, Business Week, Newsweek, International Herald Tribune, Barron's, ABC News, and PBS. We're so delighted to have you with us, Dr. Grosswald. Thank you.
Thank you, Rita. It's a pleasure to be here. You know, as we've heard very clearly, autism is a stress-related disorder, that it represents severe stress to the nervous system. We've also heard, though, that the Transcendental Meditation program is an effective modality for reducing stress. And when we reduce the stress, we start to see changes in behavior regulation, in sleep, and that cascade of benefits. But we also see changes in brain development. And what the research shows is that TM actually enlivens the whole brain, particularly the prefrontal cortex, the front of the brain, that part of the brain that's the executive function. And so we start to see the things that we've heard about today, the mental flexibility, the willingness to try new foods, the sociability, the willingness to try to interact with others and just to develop a wider world. And so that effect is, changes the life of an individual. Not only is TM effective for the individual, but as we've seen, as Roberta talked about, the effect for her, for the family. When there's an autistic individual in the family, the dynamic is significantly affected. There's stress with the child that the parents respond, that then the child responds, and so it escalates. And we see this dynamic. And so when we reduce the stress of the child, but also reduce the stress of the family, it changes the whole dynamic, the whole interaction of the family as things change and reduce this, that stressful sort of interactive dynamic there. And so we see the increased involvement in the relationship with the family, with the individuals there. We also see that there's the improvement in creating sort of wider world, a wider world inside and out for that individual. And often we hear, you know, we've heard the stories that obviously someone with autism can do transcendental meditation, but how is it that they can do it? Well, anyone who can think can do transcendental meditation. It's that simple, that easy. Requires no attention, no focus, no concentration. Very simple, easy technique. Now, as an adult, we often see someone sit to meditate. They sit quietly, they close the eyes, they're very settled. Someone with autism may not look the same when they sit to meditate, but they are able to do it. They are able over time to keep their eyes closed, to reach that settled state. And when that happens, the whole dynamic within the nervous system begins to change. And it also enlivens that brain. And so we see with the Transcendental Meditation technique the ability to create a wider world, both inside and out for that individual.
Very interesting. I want to ask you, for the parents listening out there, and I know we have so many parents listening, how do they go about, they're hearing this concept maybe for the first time in some cases about TM, how do they go about doing it?
Well, the TM technique is taught in 7 simple steps. And the first step is just an introduction to it and a little explanation about the research, and then there's a brief personal interview with the teacher. The interesting thing about Transcendental Meditation is it's taught only by certified TM teachers who have been through very extensive training. And they're able to work with individuals of all types and all ages. And then the actual instruction, in just maybe an hour is that instruction, and in an hour they learn the technique. And then there's 3 consecutive days of follow-up, maybe about an hour each. And if someone is younger, then their meditation time is shorter, but usually it's for an adult 20 minutes twice a day. For somebody younger, as was mentioned, 10 to 12 minutes twice a day. And that's it. And then they have a technique for life. This is something they take with them anywhere they go, with them forever. Always creating that inner silence, that inner peace.
You talked about also the effect on the frontal cortex too, from the brain, the physical
Yes.
evidence, which is fascinating to me as a journalist to hear the actual physical results. Do you see those results almost immediately? I know you had talked about 2 to 3 months or a period of time, but in some of your research, are you seeing the results of the relaxation, especially with those with this type, with autism disorders with different ends of the spectrum? Are you seeing it almost immediately, or does it take prolonged time till you can actually see those physical effects?
You know, it really depends. It depends on the individual and the symptoms and the extent of the symptoms. But what we do see is that whatever is the biggest impairment, whether it be social skills or whether it be sleep or whether it be interaction with others or communication, whatever it happens to be, we often see that's the first thing that becomes noticeable. But that settled state, that person experiences that right away. Even, you know, autistic individuals sometimes, as I mentioned, aren't as settled in their meditation. In fact, it's funny, in some of the folks that we've taught, especially the children, we see them in very interesting positions. An adult sits and meditates quietly this way. I've seen children, you know, move around quite a bit, turn around in their chairs, and you think, oh, is that child really meditating? But they are. The technique is that powerful. And then when they close the eyes and experience that the mechanics of the technique itself, it begins to work. And so that individual feels that settled state right away. And then it may take longer time before we see that outwardly, but they feel it right away.
That's fascinating. And you know, Dr. Stixrud, so many people out here and so many parents are, you know, it's a heavy burden. As I mentioned, I'm the godmother of 2 autistic kids, and I see so much what one of my dear friends goes through as the mother, and the anxiety that's on the parent, not just the child. How much do you feel this approach TM is compared to other approaches out there? Is this something that you really think is a standout and something that absolutely needs to be developed further with clinical trials and so forth? Does this seem to be the most responsive?
Well, again, this is something that, how many people do we know for whom it's life-changing? And I've certainly seen kids with anxiety disorders, kids with mood problems.
Right, the full ends of the spectrum. You talked about even soldiers, too.
Absolutely.
It's fascinating to see the different levels of anxieties.
So the idea of actually empowering somebody with a technique through which they can really rewire their own nervous system and make it less reactive to stress, and find out that you actually have a calm center inside. It's a remarkable thing. And I think in fact, that it's cruel that knowing that, when we know not to teach it to kids, at least give them the chance to do it or not. I think it's a very powerful thing.
Were you surprised? And I'm so surprised when I see the video and I see people like Joey Lowenstein sitting there calmly, again, peacefully. Were you surprised at the ability when folks who are on one end of the spectrum and have severe issues and are able to find that tranquility, that inner peace? It's remarkable. Were you amazed to see it yourself?
Well, I've seen it. I wasn't amazed because I've seen it enough before. And one of my autistic kid, who I think was 10, within a couple of weeks, he told his TM teacher, he said, with TM, you can stay cool, so you can keep the heat. You can take the heat.
Mm-hmm. They have these great lines, like Roberta's son. Calm the mind, calm the mom, and this one. These are my favorites.
So yeah, so I'm not entirely surprised. Initially, again, I hadn't thought about it for years. I think, well, it'd probably be too hard to do. And then it turned out we heard about these kids who could do it, and for whom it was extremely effective. And
talk about just what a relief for parents out there, too. Yes, you think about it, Dr. Grosswald, it must be just overwhelming, the response that you're getting and you're both getting from parents.
It's usually the parents that have the first interest. Just as Roberta mentioned, it was she that learned TM first. And they don't initially think that their child can do that. But when the parent learns and they're able to respond differently, and then they begin to recognize maybe this is something that my child can do, and then they pursue it and they say, they ask, is that possible? And again, we often think this is something that someone with autism can't do. But if someone can think, they can do Transcendental Meditation, really. It's that easy.
Well, I feel like I've learned a lot. I hope everybody at home has too. Thank you both very much. And we now have one final video. We've been talking about the effects of this incredible TM on those with autism on different ends of the spectrum, but also it greatly affects the families. Take a look.
My restaurant's called Coco Sala, and our theme is coffee, chocolate, and cocktails. It's a lot of fun. It's a lot of work, though, too. What are you working on? I have 2 beautiful children. Justin has high-functioning autism. By the time he was in 6th grade, he was formally diagnosed with Asperger's syndrome. He has difficulty socializing with others and reading other people's social cues. He doesn't have any friends. Being a business owner, you have a million things going on in your head, and then on top of that, to be a mother of 2 very active children, it's a lot. It's a lot to handle. So I started researching about meditation and came across Transcendental Meditation. Within the 2nd day of learning TM, I felt like a completely different person. I found myself much more focused. I found myself procrastinating less, and I found myself happier. Before doing TM, my mind was always, on the go, 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 and I did have difficulty sleeping at night. Not just falling asleep, but staying asleep. And about a month and a half after doing TM, I suddenly started sleeping through the night and falling asleep much easier. Justin learned how to meditate over the summer. It had been a month he had been meditating and went back to school, and actually one of his teachers remarked about how much more relaxed he seemed, how his shoulders were down, how he was making better eye contact. She told me that one of the parents had even commented and asked if Justin was on a new medication, that he just seemed so more relaxed. I think that it's very valuable for parents of kids that are on the spectrum, not just for the children, but for themselves, because When you're more relaxed, you're able to deal with whatever issues may present themselves. Until it starts reducing itself, you don't realize it. Sometimes you don't even realize how stressed out you really are. TM, it's the me time that I'm getting for myself, which then later on benefits everybody around me, not just myself. And this is for life.
I want to thank our very distinguished panel of experts, Dr. Norman Rosenthal, Dr. David Black, Roberta Lowenstein, of course Joey, Dr. Bill Stixrud, and also Dr. Serena Grosswald for their wisdom, insights, and sharing their experience with all of us today. I also want to thank our wonderful and deeply dedicated sponsors, the Joey Lowenstein Foundation, the David Lynch Foundation, and the Center for Autism Assessment and Treatment. If you are interested in learning more about Transcendental Meditation and how it can be used to help you or a family member or your clients with Autism Spectrum Disorder, please be sure to reach out and write autism@davidlynchfoundation.org. Again, the address, you can see it there on your screen. It's autism@davidlynchfoundation.org. Thank you for joining us today for this powerful and very inspiring webinar.